being of men. Now, in a society that still rewards silence over softness, many men suffer quietly from stress and depression to substance abuse and sexual health struggles. The pressure to man up is costing lives and even relationships. Today, we are joined by Ernst Van Rensburg, Clinic Admin Manager at Dis-Chem, who reminds us that real strength begins when we ask for help. Ernst, thank you so much for your time and welcome to the Upside.
Thank you. It's very nice to be here. Thank you so much.
It's 2025, Ernst, and we still are dealing with the stigma when it comes to men talking about their mental health, men opening up. Why do we still find ourselves here when seemingly it looks like there are more platforms now than ever before for men to be able to speak up?
Yes, absolutely. And unfortunately, we see that even though we are really progressing with medicine, with research, with everything that's happening in the medical research environment, especially in South Africa. But it feels that with mental health, we have really reached the plateau, and it's all to do with stigma. It's all to do with especially men struggling to open up and struggling to seek help when they absolutely need to. So. We are really working very hard to create awareness and to make sure that men seek help when they need to.
Ernst, do you believe that better mental health support, especially for men, could possibly assist in reducing abuse in households?
Absolutely. Gender-based violence is a real concern in South Africa. It's something that we take incredibly seriously, and it's a concern that has really received a lot of attention lately, it's brilliant that a light is being shined on this problem, right? And when we delve deeper into gender-based violence or violence in a household, it's not necessarily only gender-based violence, but violence as an entirety. We find that a lot of the driving factors around violence has to do with mental health related concerns. And we see that many times it is addiction driven, or it's to do with men not seeking help when they need to. And often when a mental health issue sits and it's not something that is being resolved, it's not something that's being treated, it's something that gets worse and worse and worse over time. It's this developing condition ultimately, and it spills over into every single facet of a person's life. And ultimately, when a person has a mental health condition, they need to treat it in some way. I don't know, treat might not be the correct word, but they want to almost find a release for tension that is building up within themselves. And one way that men often find that release is unfortunately to be quite violent.
Are clinics and healthcare providers, are they doing enough to encourage men to take better care of their health and educate them that there are other alternatives, there are other ways of managing? If you are dealing with stress, there are other ways of dealing with it as opposed to being violent?
It's quite a difficult question to answer. And the reason why I'm saying that is that I think we can have a whole entire show just on this topic, right? It's so interesting. Whether or not healthcare workers are doing enough, in my personal opinion, I don't think so. I think that we are focusing a lot. We've never been as far today in 2025 as we've never been as far as we are today, right? But there's still a lot of work that needs to be done. In a certain sense, we as healthcare practitioners, we tend to over-medicate patients. We easily medicate, where there's a lot of different approaches that needs to take place to ultimately treat a patient with a mental health condition. It's not only prescribing a certain medication, although medication really forms an integral part of treatment. Absolutely, that will always be the case. Many times it has there's a holistic approach, an approach from different angles in terms of therapy, and trying to find out, is there a cause? Is there something that is driving and exacerbating this condition that someone might be sitting with? So it is a difficult question to answer. Some healthcare practitioners might be doing more than enough, really driving awareness and trying to break down the stigma. But I do believe that education in the community is important, but also education amongst healthcare workers to make sure that patients are treated effectively.
Ernst, how do we identify, how do we see that someone is experiencing mental health issues? This may be a family member, a friend, a colleague. How do we go about spotting that, something might not be 100% here?
It's really, it really has to do with the situation. But in general, firstly, in my opinion, it has to do with it starts with taking someone seriously. If a patient, for example, if a family member comes to you and says that I have an issue at home, me and my spouse, we fight very often, it becomes violent, and that we as healthcare practitioners take that seriously. Because what we often find is that victims of abuse tend to downplay what is actually happening at home. And when a victim comes to you, I want to say the word victim because there's no other way of putting it, but if it's a family member that comes to you as an example and they raise these concerns and they explain what's happening, you need to take it seriously, because I can guarantee almost that what's really happening at home is probably a whole lot worse than what they are describing. Because it's already very difficult for this person, this victim, whether it's a wife, a husband, it can be anyone, whether it's already very difficult for them to take that step to seek help. Because usually a victim of abuse, remember, it's not only physical abuse, it's psychological abuse also. So a victim of domestic violence or gender-based violence might start to question their own reality in terms of, is this something that I am imagining? Is this as bad as I'm imagining? Meanwhile, it's extremely bad. So by the time they reach a point where they seek help, they might already be questioning their own reality. And that's why they tend to downplay it. So the point is that if someone comes to you and they mention something that's happening at home, take it seriously, refer appropriately, and make sure that they get the help that they need.
Ernst, I would love to continue the conversation, if you don't mind hanging on the line for us, because I know for some people sitting at home listening in on this conversation, those who want to be proactive in this pursuit of managing their health, managing their mental health, may have a few questions. So we're allowing them now to send through their WhatsApp messages. If you have any questions, send it on our WhatsApp line, +27 63 406 9126. And Ernst, when we come back, I would love for us to talk about some practical steps that we can take to prioritize our mental health as men. Where can we seek help? And also the role that that sexual health can also have, and in terms of impacting our mental health. So very important conversations there. It's now 30 minutes after 1 p.m. Central African time. We'll continue our conversation with the clinic admin manager at Dis-Chem, Ernst Van Rensburg, as we shine a light on men's mental health this month of July. For now, though, let's head on over to Musibudi Makura, who has your sports news. And by the way, congratulations to Mamelodi Sundowns. We are still in conversation with Ernst Van Rensburg, Clinic Admin Manager at Dis-Chem, to continue this conversation. Ernst, earlier you mentioned how poor mental health can spill over into other aspects of your life. Let's talk specifically about health, how poor mental health can affect your overall health.
So it's a really, really, really valuable question. So one thing that we see a lot in practice is that when patients' mental health is neglected for quite a number of years, is that they tend to neglect other portions of their health, if I can call it that, other facets of their health as well. So, for example, and this is merely an example, if you have a patient that has substance abuse problems, then by the time that that patient usually, or many times, seek help is when their condition has progressed to a point where it is dire. They need assistance and they need support as soon as possible. So we typically see, because this is a condition, mental health in men is a condition that we have neglected for many years as men ourselves. We often see that by the time men seek help, their overall health has been neglected. So you might have someone who suffers from a cardiovascular condition, but because they have a substance abuse problem, they haven't given attention to that, to take their other medications. So by the time, again, that they seek help, it is absolutely, a patient might be in heart failure. It's just an example. So because they haven't really paid attention to the other portions of their health.
Ernst, situations like a low sex drive, erectile dysfunction, could these be also linked to mental health?
Absolutely. One thing, again, that we see in practice quite often is that men tend to experience a lot of shame when they experience anything that affects their sexual well-being, whether that be erectile dysfunction, whether that be a testosterone, low testosterone levels is another good example. So men tend to experience this overwhelming level of shame when they have a condition where they can't, in their own opinion, perform as they normally would sexually. So there is a definite link between sexual or reproductive health in men and other mental health conditions. And there's a few other reasons for that beyond just the shame that men experience. For example, low testosterone levels is also linked to symptoms of depression. So it's this shame that men experience, but together with that, there are other side effects to experiencing, for example, low testosterone levels. So there's a definite link between the two, and it's something that really needs to be taken into consideration. And you have to ask patients these questions, because shame is something that you can't get rid of. You can't move past it very easily. So you have to ask the correct questions to get the right information from the patient, to treat them effectively, ultimately, and to find the source of their mental health conditions, which could obviously be a sexual reproductive issue.
We are currently in conversation with Ernst Van Rensburg, Clinic Admin Manager at Dis-Chem, giving us some tips on how we can better manage our mental health as men. We were talking about the causes and what we need to look out for and the impact that poor mental health can have on your overall health. Next, I want to ask him to share some tips, screenings. How often do we need to go get screened, and where can we seek support in our communities? We'll ask that question right after this. We have a bill to pay, Ernst. It's 10 minutes before 2 p.m. Central African time.
We take no sides, none whatsoever. We are the Upside.
Well, we're prioritizing men's mental health this afternoon on the Upside, and we're joined by Ernst Van Rensburg, Clinic Admin Manager at Dis-Chem. Ernst, when should we go and get tested, get screened? How often do we need to go get checked as men? Because oftentimes we run away from the doctors, we run away from the screenings because we don't want to know what is happening lest we see something we don't want to see. But how often should we prioritize that?
It's generally advised that men go to a doctor or to a nurse, whatever you have access to, at least once per year. Don't only go when something is wrong. Obviously, definitely seek help when you notice that there is a change to your overall health or your mental health, any aspect of your health. If there is a change, go to, or if you have a symptom that is lingering, it's not something that is really getting better, go see a healthcare practitioner, because it might be something that really, really needs attention. But beyond just that, rather, we always advise that you go to a healthcare practitioner once per year just to check whether everything is okay, because we tend to, the word is compartmentalize our health. You have your physical health in a silo, and then in another silo you have your mental health. But we don't always take into consideration how the one can affect the other.
Yeah.
So you might be experiencing significantly low blood pressure, just as an example, but that is affecting your overall performance in other aspects of your life. So you start to experience a mental health condition because of a physical symptom that you're having, but we don't always put those two together. That's why regular checks or screenings is so important, to make sure that all of the basics are covered. And then if there are other issues that arise, that we can, again, refer appropriately and treat effectively.
And outside and beyond the screening, what can we do at home? Practical steps that we can start taking to prioritize our overall well-being and our mental health?
It's a really valuable question. And one thing that we really see a lot is that a lot of people in general, it's not necessarily only men, but we do see it a lot amongst men as well, because in South Africa, a lot of men are breadwinners in their family.
Yeah.
We see that men tend to not take as much leave or take as much vacation time as they actually should, because a lot of men in South Africa are of course paid by the hour. They don't have the luxury or the ability often to take the necessary leave that they need to. So we have this lingering sense of burnout amongst many men. But because you can't necessarily take leave, it's something that tends to be suppressed by substance abuse, alcohol, that sort of thing.
Yeah.
So things that we can do: take leave when appropriate. When you can, plan your leave, plan your year, schedule time away from work. If you do it in advance, it's much easier to actually plan your life around that. And we underestimate the value of taking a break. It's so important. So take regular breaks. Of course, exercise. Exercise is so valuable with maintaining optimal mental health conditions. And also, if anything changes in your life, as I mentioned before, if you find that your mood is changing, your energy levels are changing rapidly, there are sudden changes and you don't know why it's happening, go see your doctor or your nurse so that we can find out what exactly is going on and that we can help you to manage those symptoms. Don't ignore any symptoms that come your way.
Wise counsel there from you, Ernst. And then finally, for the youth of South Africa, so as to not make the same mistakes as the generation before us, what advice, what tips would you like to give to them when it comes to prioritizing their health?
So it's a two-faceted approach. One thing, before I answer your question, one thing that I just want to mention is that as parents, we need to be very mindful. As fathers, we need to be very mindful of the example that we set to our sons. If you are setting an example where mental health is something that we ignore, we suppress, we don't talk about it, it's a sign of weakness. It's shameful to admit that you have a mental health condition. If you take that approach, you are essentially setting that example for your son. Same goes for gender-based violence. Same goes for domestic abuse. If you set that example, that is most probably the path, or you lead the way for your son to follow. So you need to be mindful of the examples that you set to your sons, and that's the one part. So to answer your question, as the youth in South Africa, we need to make sure that we educate ourselves in terms of knowing what to look out for. So one thing that I always say is that you need to make sure that you have a trusted healthcare provider. And that can be a doctor, a nurse, it can be anyone, it can be a community leader. It doesn't necessarily have to be a healthcare worker, but it's someone that you trust, someone that you can speak to, someone that you don't have to shy away from, or that you can just ask advice. It's so incredibly valuable, because as one thing we see in the youth is that many times they don't have that support. They don't have anyone to speak to, especially if they can't speak to parents. So they don't know what to do. And social media is so dangerous. So rather than seeking help and advice from social media, speak to someone that you trust in the community that you know will give you objective advice and perspective. And that is really the advice that I can give to the youth.
Ernst, thank you so much for your time this afternoon. This has been such a valuable conversation, and I hope that the men listening at home, not just the men, communities at large, will start prioritizing their mental health. Not just men, but all of us will need to prioritize our mental health, as it does spill over to other aspects of our lives. We thank you so much for your time this afternoon on The Upside.